Hello, Bay County and surrounding areas. This is Dr. Wade Reinhardt with First Choice Physical Therapy again. I'm going to demonstrate another joint mobilization technique. It is a cervical manipulation. It's very similar to some of the other techniques that we do throughout the spine, and it's very, very helpful to help the movement of the spine. A lot of times, whether it's our job or just staying static. One of the things that we do in physical therapy is we want you to move. And that static positions of our jobs today, it doesn't lend itself well to joint mobility. And that's what a manipulation for the spine really is. We're just improving mobility. Nothing's out of alignment, so to speak. It's just not moving like it should. This, coupled with a series of exercises and some soft tissue and some other things that we have, is a fantastic way to help alleviate headaches, neck pain, thoracic pain, low back pain. This is what we do. We dial in a specialized program for you and implement it here with the hands of professionals who've been trained for many years. We've got a collective experience here of over 100 years worth of therapy. Dr. Brett Frank, who is my partner in crime here, he is a 23-year veteran. I'm a 22-year veteran of physical therapy, and we just want to help you get better. That being said, we want to show you this cervical technique to kind of take some of the scary off of the manipulations that we do. A lot of people's like, oh, you're going to crack my neck. No, it's mobilization. And if there's a pop, great, that's fine. It feels great. But if not, we're still going to inch our way into movement so that you can do your job better, have less headaches, have no neck pain. I mean, we've got thousands and thousands and thousands of hours treating patients, and they all love this technique. I've got Morgan. She is our front desk receptionist. She mans the front for us, and she's going to be, again, my trusty patient here. And as I go in, I'm going to put my mask on because we are practicing CDC recommendations. We've got one of the largest clinics in all of Northwest Florida, which means we can socially distance even in our clinic. It's Hurricane Michael's caused us to have to do this, but it's a blessing in disguise. So now we're ready for this. And as I put my mask on, if you'll follow me over here, one of the things that we always do before we do joint mobilizations is we assess the joint. We want to feel how it's moving. And she's already admitted that there are some cervical problems. Just sitting in front of the computer. We try to keep our staff healthy and give them great ergonomics at their desk with specialized chairs and different heights of cameras. But regardless, you're still going to have problems if you're in a static position. Morgan, I'm going to touch your neck, okay? Mm-hmm. So I'm just going to come in here. And what I'm feeling, you are a little locked up, aren't you? All right, we can fix that. That doesn't feel too good, does it? Mm-mm. Yep, okay. And then, which side hurts you the most?
Usually this side.
This is the side that feels the worst to me. Mm-hmm. Just the lack of mobility is what I'm looking at. So Morgan, what you're going to feel is you're going to feel a little thrust. Okay, mm-hmm. It's going to be quick, easy. You may hear some pops, you may not hear some pops, but it shouldn't hurt at all, and it should feel pretty comfortable. So what I want you to do is just to relax, and I'm going to come in here just like I was just there. And what I want you to do is just let me feel that neck there, just like that, and there you go. Piece of cake, right?
Yeah.
That was the chair squeaking, not your neck. But you felt the cavitations, the pops all the way up and down. We're gonna go to the other side. Just like this, and just relax your head. My hand is a pillow. There you go. There you go. And we give a little courtesy stretch afterwards. And there would be some exercises to follow. There'd be some soft tissue to follow in here. She keeps a lot of her tension up into the upper traps and the scalenes and this area, because she does a lot of great work for us up there. And this is the person you'll be talking to mostly when you come in. She's fantastic. Thank you, Morgan. Sit up for me if you wouldn't mind. Now, you had some neck pain before you came in. I mean, what's it feel like now?
It feels a lot better.
What's your range of motion? Move it around. It just feels freer, right? Mm-hmm. And that's all we're doing. We're just trying to free up the joint. And that, coupled with the exercises and the soft tissue, is a fantastic way to knock out headaches. Guys, if you need us, call us 248-1600. Check us out on the website www.readytogetbetter.com. We have some other exercises and stretches for your neck on there that you can try to implement before you even come in. And if that helps you, great. But if you need us, we want you to think about us, and I appreciate you watching today.